Hey everyone, Michael Dudley with Engooden Health. I have an awesome patient success story I want to share with you today between our care navigator Shelly and her patient John Doe that just highlights how much can happen in 1 month. As a background on Engooden Health, we are hired by our primary care practice to be able to reach out to their patients every single month to be able to help provide education, coaching, and accountability that help them to be able to make lifestyle changes, ones that keep them out of the hospital. This program is completely paid for by Medicare. So in this story, John and Shelly have been working together for months, and last Shelly had heard, John was preparing for a hand surgery later in the month of August. So when Shelly reaches out to him in September, she's extremely surprised to find out that John's hand had been oozing for 6 weeks. Through later questions, she found out John had actually become overwhelmed with his health. Not only had he stopped taking care of the wound on his hand, but he stopped taking his medications, stopped monitoring his blood sugars entirely. So Shelly obviously was alarmed. She asked to take his blood sugar levels right there on the phone. It was 545. She discussed with him how dangerous it was for it to be that high, especially not knowing how long it had been that high. So we have escalation protocols with the practices that we work with. So based on that, he did agree to be able to work with his care team to work through insulin regimens, to be able to get his levels lower. Shelly circled back later that day and spoke with him, and he just wanted to be able to get back on track and was so thankful that she called that specific day. Now fast forward 2 months later, here in November, his blood sugar levels are in the 130s to 150s. He's taking his medication regularly and now wears continuous glucose monitor, and his hand completely healed. So it just shows how much can happen in 1 month. I would say most of the groups that we work with, they essentially don't know what happens to patients in between the 2 to 3 visits they have each year with the practice. And so they just want to make sure that they're headed in the right way, they have the right education, the right coaching in between these visits to be able to help them manage their own chronic illness. So if you'd like us to be able to repeat the same success with your practice or with your physician, please get in touch with me. You know how to find me. But I hope you have a great day, and I hope you have a happy Thanksgiving.